Good health, and welcome to today's edition of About Health, sponsored by the African American Wellness Project. Today's program is on the Affordable Care Act, so-called Obamacare. We're going to find out what's in that act and how we're doing in rolling it out. Let's begin our discussion. It's only fitting that we begin our discussion of the Affordable Care Act by talking with Dr. Ennix, who from the very beginning of the act has been a solid advocate in explaining to people what their options are, and explaining to people about the value of the act. And his work in this community has been so valuable to so many people. So thank you for joining us.
A pleasure, Michael.
Tell us, first of all, why you're so excited about the Affordable Care Act.
That's a good question. I think that my interest and excitement first started a number of years ago when I traveled abroad, particularly to Paris, France, and learned that even though we use the very same instruments, the very same techniques, that the cost of open heart surgery in Paris was so much lower than it is here in the United States. And it rather piqued my interest because I knew then, as I know now, the quality of their medical care is every bit as good as ours, if not better. And that's how my interest started. I would say that I came to the realization that medical care should be something that all Americans have, just like education. It was some 200 years ago when the decision was made in this country that it would be better for society if everyone was educated. I think now that same thinking is coming to bear with regard to medical care, that we would be a better society if everyone had quality health care available to them. And that's why I'm excited about the Care Act. Some 45 million Americans have been uninsured through the years. A very, very large percentage, 17% of our society has been uninsured. And it has been known for a number of decades that people who are uninsured, it is related to poverty. And in this country, being poor should not be a disqualification for getting good health care. And so what the Affordable Health Care Act does is bridge that gap between those people who have insurance and have access to health care through their employer and those who do not. There have always been a group of people who could, well, not always, but since the Medi-Cal Act was passed, there have been people who had access through Medi-Cal. And of course, there have been people who have had access through their employer. But there has been a large number of people between those two extremes who have not have access to medical care, and that's because they cannot afford medical care in most instances. And it is that group of people who are in particularly targeted by the Affordable Care Act. But the fact of the matter is, I think it is lost on so many people that the entire population benefits. Health issues have been the number one cause of one losing their assets. And particularly if a person has had a condition such as diabetes or such as heart disease, then the insurance company has had the right heretofore not to cover them. And so if they get sick, it can ruin them. It can ruin the individual. It can ruin the entire family. And so now with the Affordable Care Act, that cannot be. But in addition to that, There are many, many other goodies.
But before we get to that, I think what many people in this country don't understand is that that healthcare has been dragging down our economy for a number of years. And when we talk about the Affordable Care Act, everybody focuses on the specifics of the act, and we will in the second phase of our program. But it really does, you make such a great point, that the cost of health care was dragging this economy down. And unless we got a hold of those costs, and not only that, it didn't guarantee us quality health care, did it?
No, no. And you know, I like to use education as a parallel. It was clear, it has been clear over the past 200 years that ignorance drags the economy down.
Ignorance drags everything down. But go ahead.
Yes. And so it is clear to me that a healthier population will add to our economy. It will add to the growth of our economy. I am absolutely convinced of that. Heretofore, healthcare has cost this economy some 18% of the gross domestic product. Now, right now, there are signs that that is beginning to decrease.
Our discussion is on the Affordable Care Act. We'll continue our discussion with Dr. Ennix and talk about the specifics of the act right after this.
What does hope look like? It's in the rising walls of a home rebuilt, raising the spirit of a community reborn. What does heart sound like? It's in the rhythm of nails pounded into wood, a beat driven by the conviction that inspiration can overcome desperation. What does home feel like? It's in the faces of Americans who built generations of memories in their home and then saw it slipping away, until friends they had never met turned out to lend a hand. For more than 30 years, Rebuilding Together has spread hope to homeowners in need, providing free home rehabilitation, making homes safer and more energy efficient. This is a place where you can turn dreams into reality. Go to rebuildingtogether.org and share the feeling of home.
When I grow up, I want to be a psychologist or a therapist.
I want to be a pediatrician.
I was hoping to become a chef someday.
I want to study law. I don't want to become a lawyer. I want to become a CIA agent.
Young people, I think, do need a mentor because, you know, we don't know everything. And, you know, all the people, they've experienced stuff that we haven't.
I would like to be a baseball player.
As long as there's somebody behind you, pushing you and supporting you, then you feel that you always have the strength to keep going.
Each of our children has hopes and dreams for their future. Help them get there. Become a mentor.
Before his injury, John Bennett was a career soldier. While serving in Iraq, he was shot by a sniper.
Stepped out, turned back towards the Humvee, and as soon as I did, I got hit. It shattered 2 vertebrae and fractured another one. I ended up losing my right kidney, my spleen, my colon, and half my pancreas.
Paralyzed Veterans of America got us our benefits.
I helped them fill out the forms. I hand carried the forms over to the VA and walked them through the system.
You're just trying to survive, and they help you along the way.
It's very nice to see when your work pays off and you're very successful in it, because you can see the change in that veteran.
Him starting a taxidermy business is accomplishing something every day.
I get to get up, go to a job, and do something that I enjoy. I'm glad to be back to work.
To learn more about Paralyzed Veterans of America, visit pva.org.
Be the hero.
Be the game breaker.
Be the turning of the tide.
Be the guiding light.
Be the difference.
Be the difference.
Be the difference maker.
Be the one.
Be the one to save a life.
Patients with life-threatening diseases of every age and race
are searching for a Merrill match.
Join the Be the Match Merrill Registry.
You can be the one.
Be the one.
Be the one to save a life.
Welcome back. Our discussion on the Affordable Care Act continues with Dr. Ennix, an early and effective advocate for the Affordable Care Act, to talk about some of the specifics of the act. What can people expect?
Number one, we can expect a healthier population. Okay? Overall, we can expect that healthcare will account for a less amount of money than it has in the past. But specifically, you take here in the state of California, we have what's known as Covered California. Now, Covered California is a what's known as a marketplace, even though I don't in particularly like the term marketplace, except for the fact that it denotes transparency. What it implies is that choosing an insurance can and should be just as easy as going to a supermarket and choosing between fruits. In other words, complete transparency where you can compare apples with apples. And that's wonderful because you can select here, you can select an insurance, a coverage that's tailor-made for you.
Now, what are some of the benefits?
Oh,
what could people expect? I know it's not just the insurance. Can you go through some of those?
Sure. It's important for everyone to understand that the insurance available for people who register on Covered California is the very same insurance that people get through their employer. High quality insurance coverage. The difference is, if you get it through Covered California, you can get help from the government if you qualify to get help from the government. Now, with that in mind, in terms of the benefits are the same as anyone else would get. A hospitalization, emergency care,
mental health?
Yeah, of course, mental health, pap smears.
Right.
Immunizations, and the whole gamut of healthcare needs.
And in fact, each insurance company is required to have certain, metrics that they have to meet. I mean, you can't just put an insurance company on the exchange. They all have to have certain things as part of the coverage.
The key here is transparency and standardization.
What I like about what you're saying, that each insurance company in the exchange has to have a full range of services. It can't just be a service here, a service there. Is that correct?
Not only is that correct, but two things are important: transparency and standardization. That is to say that each of the insurance companies that agrees to be on the exchange must do the same thing that all the rest of them are doing. They must be identical. The product must be identical in the main in terms of what it offers. Now, there are differences in each panel of coverage. There is a platinum, a gold, a silver, and a bronze. The gold covers about 90% of your cost as a consumer. The bronze will cover 60% of your cost as a consumer. The gold, the consumer pays more. The bronze, the consumer pays less. But all of the plans are identical, pretty much, with the exception of the doctor and the hospital. In other words, to put that another way, if you want to assure yourself of getting the doctor that you've had all along, then the higher cost plan may be the one for you. But on the other hand, if you look at the plan, it could very well be that your doctor is on that less expensive plan. But keep in mind that if you get the less expensive plan, if you do need health care, then your copayment will be more. But also keep in mind that if you are 30 or 35 or 40, that may not make you any difference. But if you're 65 or 70, maybe it will make you a difference.
And I think that in spite of all of the early rollout problems, certainly Covered here in California, we did quite well, didn't we?
we have done extraordinarily well. As a matter of fact, to date, it is estimated that over 12 million people have signed up. If you look at the state-run as well as the federal run plans, as well as look at the expansion of Medi-Cal, that's extraordinarily important. It's Medi-Cal in our state, Medicaid in other states. But with the expansion of Medi-Cal, and what do I mean by that? Heretofore, you could qualify for Medi-Cal only if you earned a certain level. Right. But now that level has been expanded to 136% of the federal poverty level.
Well, Dr. Ennix, I personally want to thank you for your advocacy, the fact that you've been going around explaining this act. I remember you saying to me when this act first occurred, even before we talked about the uninsured, you said what a pity it was that we didn't have insurance for everybody. And now that we've had this opportunity, you've done a great job. Thank you very much.
Well, thank you. Thank you. It's been my pleasure, Mike.
All right. We'll be right back.
I'm on a mission to spread the word about COPD, the only way I know how, through music. COPD stands for chronic obstructive pulmonary disease, but it's sometimes called chronic bronchitis or emphysema. It's a lung disease that takes away your ability to breathe.
4 minutes, Billy Ray.
COPD is the 4th leading cause of death in the U.S. and kills 1 person every 4 minutes. My grandfather suffered from symptoms of COPD. Many people don't find out until the disease is already in its late stage. And I have to try to raise awareness of this serious disease. Because if you detect it early, there are steps you can take to manage your symptoms. I'm Billy Ray Cyrus, and I drive for COPD. Anyone age 35 and older who has smoked as little as 100 cigarettes could be at risk. Looks like people are starting to get the message. Take action today to breathe better tomorrow. Visit driveforcopd.com today to take the 5-question screener and talk to your doctor.
The Coast Guard Foundation gave me funds to attend school. During that same time, my wife was pregnant. The foundation's grant allowed us to buy food, diapers, clothing.
Coast Guard Foundation really helps us to keep in touch with our families. They make an impact, and it leaves an impression that you don't forget.
I would like to thank the Coast Guard Foundation for helping out when times were tough.
Because sometimes, even the rescuers need to be rescued. The Coast Guard Foundation, proudly supporting the men and women of the United States Coast Guard and their families. Find out how you can help at rescuetherescuers.org.
If you're not planning on getting pregnant now, you should know that foods rich in folic acid like white bread and leafy greens can help prevent some birth defects before you even know you're pregnant.
Welcome back to About Health, sponsored by the African American Wellness Project. And so now we're going to take some time to understand what African American Wellness Project is with its executive director, Mr. Kevin Nichols. Thank you for joining us.
You're welcome.
Tell us a little bit about the mission of the African American Wellness Project.
The African American Wellness Project is designed primarily to empower African Americans, whether it's taking ownership of their own health or maneuvering the healthcare system.
And is it a problem? I mean, well, what's the problem? I mean, we it's kind of a rhetorical question for me, but why do we need to specifically empower African Americans?
Well, if you look at the disparities in health, African Americans tend to be over the charts as far as diabetes, hypertension, cardiac disease, etc. And many, although we represent such a small population nationwide, health-wise, we're over the charts. So the goal really is to empower us to take ownership by eating right, exercising, and just really being knowledgeable and knowing about the healthcare system as well.
Well, it sounds good. I mean, it sounds good. I mean, it's hard for me sometimes as I go through this community to believe that people don't know being overweight causes diabetes. So you got to watch hypertension, or you got to. So and the people are telling them all the time. So what are we going to do differently?
Well, we're going to be places where they're at in order to reach them subliminally, hopefully, like on the radio, seeing us on television, but also in the places where they go to socialize, like concerts and festivals. Our goal really is to remind people that they may want to reconsider taking that extra bite of fried chicken or eating fried foods in general.
And don't be talking about chicken like that. But one of the bigger problems, and the bigger problems from my own perspective, is that African Americans don't get treated the same in the healthcare system. And I think one of the goals that we talked about is that we need to call that out. We need to say to African Americans at times, your health is not as good sometimes because you're not treated the same.
This is true, and I think that we're taken advantage of usually when it comes to going to doctors, selecting doctors, taking a first opinion, not seeking a second opinion, and the hassle of getting an appointment and being treated differently than other patients even. So there is a problem, and our goal really is to illuminate that and really make it a non-issue, hopefully.
One of the issues we've been talking about here on this program is the Affordable Care Act. And obviously, the African American Wellness Project is involved in the Affordable Care Act. Tell us, in point of fact, what is our involvement, and specifically, what are we focused on doing?
Our goal really is to get as many African Americans involved or enrolled into the system as possible. So that means we're going to places where African Americans, with the Medi-Cal expansion, making a certain income, really people don't know that they qualify and can have free coverage. So our goal really is when people are coming to get food, like say, for example, at the Alameda County Food Bank, we would partner with organizations like that where we can tell people, here's your food, but also, are you insured? Do you have coverage? These are the kinds of things that we would hope they would already have, but since it's clear that they don't, our goal really is to get them into the exchange.
And so we're really looking for people who are already Medi-Cal eligible, but who've just not gone down and taken that next step to get covered.
That next step, or not even knowing that this expansion exists and that they can benefit from it.
All right, so the word's been out there for a while. How are we doing it differently?
Well, like I said, we're doing it differently by, number one, we're on the radio talking about it. We have forums on the radio as well. We are partnering with organizations like the Alameda County Food Bank, the United Way, and other organizations that have a very big footprint who are actually do the next step. People can hear about it, but they also need that nudging. So we have literature that we're preparing to get out there, and also really work with Department of Human Services and things like that to be able to receive these people when it's time.
Now, people think when they have Medi-Cal that they're getting a lesser insurance. What's happening? What does expanded Medi-Cal mean in terms of the quality of services that people can get?
Well, there should be no differentiation between Medi-Cal and any other insurance. It's insurance, and the doctors are still going to get paid. So another thing that we do as the African American Wellness Project is we educate doctors on how to, the new expansion rules, how to get people enrolled, and also how to maintain the same type of coverage for these individuals as well. So there should be no differentiation in coverage. It's still insurance.
What about the social spaces? So many people in the social spaces now. What is the strategy to reach those people whose primarily may sometimes daytime activity is putting on, spirited messages and seeing themselves on these various social community. What is our social community strategy?
Our social community strategy is mainly, like I said, trying to be places where people are. So if people are spending, 1 billion people are on Facebook daily. So if people are on Facebook and they're on Twitter and they're on, other social networks, Instagram, our goal really is to be where they are, encourage them to think twice about their health, do something constructive and productive for themselves, and engage with other people that are actually benefiting from this as well.
And we give other organizations the opportunity to use some of our resources to get the word out on things that they're doing. If they want to reach the African American Wellness Project, what do?
They go online. They visit www.aawellnessproject.org to find us there. They can also follow us on Facebook, LinkedIn, and Twitter, and any other place that they are, we are.
So if you've got a health fair or you've got an event that you're doing, any of that, then we're willing to kind of use our resources to get the word out. I'm Mr. Kevin Nichols, the Executive Director of the African American Wellness Project. Thank you for joining us.
Thank you for having me.
And thank you for joining us on this edition of About Health. Remember, health is your biggest asset. I'm Dr. Mike Lenoir. We'll talk again next time.